It's 741 News Radio 1029 KARN, joined by Dr. Steppe Mette with UAMS. Good morning, Dr. Mette. How are you doing, sir? You doing all right?
Good morning, Kevin. Yes, I'm doing fine. How about yourself?
Doing fine. Thank you for being on. I wanted to check in with you about what's happening and what you might know about testing for coronavirus or COVID-19. It looks like we're seeing more tests happen in the state, but kind of clue us in on what's taking place there. Some news about this.
Sure. Happily, we are seeing an expansion of testing throughout the state, so more people are getting tested. That's certainly true here at UAMS. And as more people get tested, we have a better understanding of the prevalence of the disease, how many people are infected versus not. Interestingly, over the last several weeks, we have seen the percentage of positive tests go down, which is, I think, reflective of just more testing available and more people that actually have not been infected being tested and testing negative.
It's Dr. Steppe Mette with UAMS. We've heard so many different things about the testing. There are not enough tests. We're getting more tests. There's a different type of test. Can you clear some of that up?
Sure. So the testing up to this point really has been limited to individuals who are symptomatic, so who have historical evidence for a contact or likely contact, and who have symptoms consistent with COVID-19 infection. Those individuals are really important to test, and the ones that have had the highest priority are patients who are currently hospitalized or healthcare workers who really need to be in the workforce providing care who are symptomatic. And those individuals have been prioritized because there haven't been enough testing kits or testing capacity to go beyond that. Individuals who have not been symptomatic and are likely to have had a contact or advised to stay at home in self-quarantine, and if they develop symptoms, then there will be a judgment on whether testing is required. As more and more testing becomes available, we'll be able to loosen the criteria for testing and test more people. There are different kinds of tests, so we have been relying primarily on looking at whether the RNA or the genetic material of the virus is in the swab sample. That requires a pretty sophisticated testing, something called PCR, and that has the capacity to do so has been relatively limited. The FDA has approved both antibody tests and now a point-of-care test, which also looks for the genetic material of the virus in this sample. The ability to scale up the number of tests being done for both of those platforms is pretty significant. The problem with the antibody test is it really is a marker that you have had the infection. It doesn't tell us exactly when. So it's helpful for knowing how many people have had the infection, but pretty hard to use it as a point-of-care decision tool. However, the Abbott test and a few others that are coming down the pike that are looking at the genetic material at the point of care could be very, very helpful.
When do we expect those? I mean, you talked about more testing coming this way. When is that? Is there a date for that, or do we know about a timeline?
Well, I think it's happening throughout the country. I can't speak to how available those tests will be in Arkansas or when, but I suspect within a week or so we're going to see a further dramatic increase.
Dr. Steppe Mette with UAMS, I mean, and that's one of the concerns that you see out there that people have been talking about. Is Arkansas doing enough testing? And as I look at the health department numbers, they've tested almost 8,500 people total in the state. Is that enough, and could corona be more widespread than we realize it is right now?
It certainly could be. Again, those that have been tested, we are seeing a declining positivity rate. So that gives me a little bit more confidence that we're testing more broadly and getting a better understanding of how prevalent the infection is. But the more that we test, the better we will understand.
Right. With this, could we see some more of the hot spots in the state and maybe some of those smaller towns and rural areas? There's kind of an attitude that, we're not Little Rock or we're not Northwest Arkansas, and we're removed from that, so we're probably not going to get it here. Is that, to me, that seems like a dangerous mindset.
It is a dangerous mindset because we know, even within Arkansas, that there are some smaller communities who have become hotspots. So, the virus knows no geographic boundaries, and any community, any individual can be infected. So, to have that view is really a defeatist view of it. We all have to be prepared no matter where you are.
It's Dr. Steppe Mette with UAMS, and we'll talk again. Thank you for the insight this morning.
Thank you.